This should be our last lecture. I think this is slide 88. So step 2 of the, just to remind you, we're on hemostasis, and there are 3 steps: vascular spasm, platelet plug formation, and then coagulation or blood clotting. So in step 2, the platelet plug formation, the platelets or thrombocytes stick to collagen fibers that are exposed when the blood vessel is damaged. The platelets do not stick to intact vessel walls because the collagen is not exposed. Also, prostacyclins, I was about to say prostaglandins, prostacyclins and nitric oxide secreted by endothelial cells. Remember, the endothelial cells are the lining of the blood vessels. The prostacyclins and nitric oxide prevent platelet sticking. And then von Willebrand factor helps to stabilize the platelet collagen adhesion. So a platelet plug, in summary, is formed by platelets and collagen fibers. This process is a positive feedback cycle. As more platelets stick to collagen fibers, they release more chemicals that increase the platelet plug formation. So that causes more platelets to stick, which releases more chemicals, and it's just a cycle that goes on until the platelet plug forms. But the platelet plug is not enough for a larger injury. So the third step is called blood clotting or coagulation, and it reinforces the platelet plug with threads of fibrin, and that will form a blood clot. It's important that you understand that the coagulation step uses clotting factors or procoagulants. Mostly these are plasma proteins. The clotting factors are numbered from 1 to 13. And the vitamin that's needed for this step for proper clotting is vitamin K. This is your illustration that shows you the events of hemostasis or the stopping of bleeding. Step 1, you have the vascular spasm, which occurs in the smooth muscle lining of the blood vessel, causing the blood vessel to constrict or vasoconstriction. Then you have step 2, platelet plug formation. Remember, that involves platelets and collagen fibers, and it's a positive feedback cycle that increases until there is a plug in that blood vessel. But for larger injuries, we have to have an actual blood clot formed, which involves fibrin threads kind of weaving, becoming interwoven with the platelet plug, forming a mesh. Now, we're not going to cover the 3 phases of the blood clotting stage. You can read through it if you want to, but because of we have to cut some material out because we're only doing this in 5 weeks, so this is what I cut out. You can see a blood clot here. And then what happens once the blood clot has formed is clot retraction. But I wanted to just point out one thing here, because sometimes in medicine you hear about, especially when someone is donating blood, they can donate plasma and they can donate serum. The difference between serum and plasma is that serum is plasma minus the clotting proteins, the clotting factors. And vitamin E quinone, which is formed when vitamin E reacts with oxygen, is an anticoagulant. anti-clotting factor. And then we're going to talk about some disorders of blood clotting. Thromboembolic disorders result in an undesirable clot formation when we don't want blood clots, because they can restrict blood flow. They can also move and result in heart attack, stroke, or even you can have one that travels to the lungs. So if any of these clots travel to the heart, the lungs, or the brain, you can have death. Bleeding disorders are abnormalities that prevent normal clot formation. So we have clots forming when we don't want them to form, or the preventing of clot formation, like within hemophilia. And then disseminated intravascular coagulation involves both types of disorders. So a thrombus is a clot that develops and persists in an unbroken blood vessel. It may block the circulation, leading to tissue death. An embolus is a thrombus that is freely floating in the bloodstream. An embolism is an embolus that is obstructing a blood vessel. So you can have a pulmonary embolism in the lungs or a cerebral embolism in the brain. Risk factors for a thrombus or an embolus are atherosclerosis, which is plaque formation in the arteries, inflammation, slowly flowing blood or blood stasis, that means the blood has stopped flowing from immobility. Anticoagulant drugs are, for example, aspirin, heparin, and warfarin. I think one of these, I think it's warfarin, has another name, Coumadin. But heparin is used clinically for pre and post operative cardiac care to prevent venous thrombosis, so blood clots from forming in your veins. Warfarin is a direct oral anticoagulant, so it's a pill that you take that reduces the risk of stroke in patients prone to atrial fibrillation, in which blood pools in the heart. Warfarin interferes with the action of vitamin K. Bleeding disorders are, one is thrombocytopenia, which is a deficient number of circulating platelets, thrombocytopenia. I think you say this, petechia. In fact, let's do this. I always forget how to say that word. I think it's petechia, but we're going to look it up. Petechia. Yep, that's it. Okay, let's go back to the notes. Okay, so in thrombocytopenia, you will see petechia appear as a result of widespread hemorrhage, and that's what it looks like, petechia. And then thrombocytopenia can be due to the suppression or destruction of red bone marrow from a malignant tumor, radiation, or drugs. To diagnose thrombocytopenia, the platelet count has to be less than 50,000 per microliter of blood, and the treatment is transfusion. Bleeding disorders can come from impaired liver function, and the liver is responsible for synthesizing those clotting factors. Causes can be vitamin K deficiency, hepatitis, which is inflammation of the liver, or cirrhosis. Liver disease can also prevent the liver from producing bile, which is needed to absorb fat and vitamin K, because vitamin K is a lipid-soluble vitamin. Then hemophilia is genetic. It includes several similar hereditary bleeding disorders. Sometimes we call them free bleeders. And they are X-linked disorders, so they're more common in men. The treatment is injection of genetically engineered clotting factors, which has eliminated the need for plasma transfusion and the risk of contracting hepatitis or HIV. DIC involves widespread clotting and severe bleeding, both, and this can happen with septicemia when someone's their blood has become septic, incompatible blood transfusions, or complications in pregnancy, and this can lead to death. Blood transfusions. So this section is on blood transfusions. The body can compensate for only so much blood loss, so blood transfusions are used sometimes. So the blood volume can be replaced with normal saline, but then that's going to give you a diluted blood. It's not going to be, so normal saline or Ringer solution is just what you're given. It's just IV fluids. And so that replaces the volume, but it doesn't replace the red blood cells, so you're still not getting oxygen to your tissues. So when you receive a blood transfusion, you have to receive it from the correct blood group. Human blood groups are determined by the presence of antigens on the red blood cells. Red blood cell antigens are referred to as agglutinogens. And there are two primary agglutinogens. They are A, B, and then the RH agglutinogen is usually referred to as the D. So most transfusion reactions are caused by agglutinogens from the ABO blood group and the RH blood groups, although there are others, but these are the most common that most often affect whether or not someone's going to have a transfusion reaction. So the blood types, if you're type A, your red blood cells only have A agglutinogens on their surface. Type B, your red blood cells only have the B agglutinogens. And if you're type AB, your red blood cells have both A and B. If you're type O, your red blood cells have neither the A nor the B agglutinogens. Now, if you're type A, your blood plasma is going to produce B agglutinins, which is B antibodies. If you're type B, your blood plasma is going to contain A agglutinins or antibodies. And if you're type O, your plasma is going to contain A and B agglutinins. So let's look at the blood types. If your blood group is AB, you can receive blood from all the blood types, A, B, or O. You're the universal recipient, but you can only donate to someone who is type AB. Now, if you are type O, you can only receive from other type O, but you can donate to all the blood types. Then you have to include whether or not you are blood type positive or negative. If you're blood type positive, that means you're RH positive, and that means that your red blood cells contain the D agglutinogen. 85% Americans are RH positive. And sometimes a newborn child can get, and this is not common because we test for it and treat for it, but it's called HDN or hemolytic disease of the newborn, also known as erythroblastosis fetalis. If the mom is Rh negative and the baby is Rh positive, the first baby is going to be fine, but if there's no treatment, the mom is going to build up Rh positive antibodies or agglutinins in her blood plasma. So the second baby, her Rh positive agglutinins or antibodies are going to attack the second baby that she's carrying that's Rh positive. So the treatment for that is RhoGAM, and that's down here at the bottom. They give RhoGAM injections probably during labor when they realize that the newborn, the first child, is Rh positive, the mother's Rh negative, they will give her RhoGAM, and that will prevent her from producing those Rh positive agglutinins or antibodies. And we already talked about this. A person who's type O is the universal donor, AB is the universal recipient. And this shows you the tests that are done and what the blood clotting looks like. If a person is type AB and you give them the anti-A serum that contains A agglutinins or antibodies, then you're going to see clotting. So that means that they have the presence of the A agglutinogen or antigen on their red blood cell. Clotting with the anti-B antibodies is going to show that they have the B agglutinogens or antigens on the red blood cell. And you can see with type O, you don't have any clotting at all. This last section is on diagnosing conditions using blood tests. A common test is the differential white blood cell count. If you have increases in certain white blood cells, that can diagnose certain diseases. Prothrombin time and platelet counts help with knowing if you have the ability for your blood to clot properly. A comprehensive medical panel is checking blood chemistry. It can indicate liver or kidney disorders. It can also show disorders like diabetes and thyroid disease. A complete blood count checks the account of all of your formed elements, including your hematocrit, which is the percentage of red blood cells in your whole blood sample. It also checks your hemoglobin. So these can indicate, anemia, that kind of thing, and also cancers of the blood.